What I'd like to do is deny that coverage and stay with my current health care plan.
You do not need to take that Medicare.
Medicare's glad you don't take it because they're not liable for you, so they make it very easy.
Can I deny that without penalty? I'm currently on the disability Social Security income and received a letter in the mail that says, in this package you'll find Medicare card and a booklet about your coverage. Your Medicare coverage will start in 3 months. Check your card for the exact date. It says I'm going to automatically be enrolled in both Medicare Part A and Part B. And what I'd like to do is, for now, deny that coverage and stay with my current health care plan. Can I deny that without penalty, or do I have to accept it?
Well, let me ask you this. The plan that you're covered by now that you like and want to stay on, is it an employer-provided plan?
Yes, it's through my wife's employment. Yes.
Okay, very good. Okay, do you know if the employee side employer has to be 20 employees on the payroll or more? So would that apply? Is it a large employer?
Yes.
Okay, very good. So no doubt with that. All right, that sounds good. Okay, well, I have Nick with me today in studio, so he's a pro. Nick, let's tackle it. Let's start with you. Go ahead, answer his question.
Yeah, so Robert, technically speaking, sir, you do not need to take that Medicare here in 3 months. When did you say it's starting? Is it June or July?
August 1st is what's on the card.
August 1st.
Yeah.
Okay, very good.
Gotcha. So, what Marvin was asking, 20 or more employees, you check off that box. Wife is still working, correct? She's a current employee, active employee?
Yes.
Gotcha. Like I was saying, technically, no, you do not need to take that Medicare. You can defer that Part B. Now, what we advise is maybe looking into Medicare options, depending on how you're using that coverage and, cost comparison, just depending on how your wife's group plan is structured. May make sense to move over to Medicare. It's always worth exploring that option, and that's something, of course, we could help you out with here.
Yeah. Well, let's do this, Nick. Tell us about your wife's plan. What is it that you like about it? What's the cost of it? Those kind of things. Share that with us if you don't mind.
It's through United Healthcare, and we have a deductible of $2,500, which we've already met for the year. So that's why I don't want to change over, because we have no expenses at this time. So
okay.
Yeah, so
that's good. Now, what does it cost her to cover you, Robert?
It costs about $400 a month.
Okay, and that would be just for your portion.
Yes.
Okay, that sounds good. Okay, so let's talk. I'm gonna address you, and we'll kind of go back and forth here with Nick. But he said you don't have to take B, and that's exactly true. So we want everyone to know, you to know, and everyone to know that once you're receiving any form of Social Security benefits, whether that's retirement benefits, survivor benefits, spousal benefits, and in your case, disability benefits, you have to stay enrolled in Part A. But you don't have to take Part B if we have a good employer-provided plan that is better than the Medicare option. Now, just so you know, as I look at this, really Medicare is a better option for you. However, not for a while. And now we understand what you're doing. You're saying, hey, we've already met our deductible, and so we don't want to have to, be out of pocket anything. So what I would suggest doing is going ahead this year, going ahead and disenrolling from Medicare Part B. So Nick, he got a card in the mail. Tell him how to do that, please.
What you will do, there should be instructions on that packet you received, Robert. I believe you just signed the back of the card, send it back to Social Security. You'll get a new card in a few weeks with Part A hospital only.
That's right.
Listed on that.
Yeah. So, and he said, turn the card over. And you should see on the back that it'll say, I do not want medical insurance. And that medical is Part B. A is called hospital, B is called medical. So just check the box, sign your name, mail the card back in, just as he suggested. And then you'll get a new card in probably a month or so, I guess, Nick, and it'll say Medicare Part A only. And then what I would do if I were in your position, because $400 a month is definitely not crazy high, but it's also no bargain either, especially if you're going to meet your deductible on an annual basis. Nick, do you know if in the state of Indiana, if they offer MedSup plans for people below the age of 65? I know I'm putting you on the spot. I don't know.
Off of the top of my head, I'm not positive. Okay. Now, they will offer some sort of supplement plan.
But maybe
G
not
or
quality.
N. That's where it's just questionable.
Okay, that sounds good. Here's what we're going to do, Robert. I'm going to suggest this. Why don't you let me give you our number first off, and call in. In fact, just call in a couple hours and ask for Nick. He can take care of you. It'd be awesome. But let me give you our office number, and I'm going to tell you why. The number is 800-782-6676. Okay, 800-782-6676. So for you and everyone, here's what happens. There are federal laws and there are state laws. The federal laws say that insurance companies do not have to offer Medicare supplemental plans to people that are below 65, meaning coming into Medicare because of disability, which is your situation. In other words, insurance companies do not have to offer those. However, in many states they do. Now, some states they offer them, but they're not very good or expensive, all that. So I can't just, we're broker throughout the country, so I can't memorize every state rules. But I do know that it could be very possible that we can look at the rates on supplemental plans in the state of Indiana, and if it's attractive, and it could be. I will tell you, if you lived where our office is in Kansas or Missouri, it's a no-brainer.
Correct.
It'd be much better to be on Medicare. So I would stay on A only until the end of the year, and then Nick can explain to you the process of bringing you into Medicare effective January 1 of 2027. Then you can pick up your Part B and then get a supplemental plan, drug plan, and all that cost would probably be $400 or less, and has a deductible of $283 instead of a deductible $2,500. So I think you're fine to do what you're planning on doing now, for sure. Send the card back in, and let's stay on that for the rest of the year. But then I would still look in the option of changing this in January. And you can find that out now. You don't have to make any decisions now, but I think it'd be something I'd explore. Now, it could be that you live in a state. Texas would be a great example. There are no med subs in Texas below the age of 65. So if Indiana's like that, then you're going to just keep staying on your wife's plan. But if there's some available that are attractive, then Nick will share that with you. Now, I want to explain this to really you, our general audience too. What happens is when a state does not offer supplemental plans, then they only offer advantage plans. Those would certainly be available, but sometimes those are not as attractive. And so your wife's plan, I would say, probably would be better than that.
Correct.
Would you agree, Nick?
I would agree, especially, Robert, since you've already hit your max out of pocket. There would be no sense in restarting a $6,700 max out of pocket on an Advantage plan and then restarting that on January 1. So
and then I want you to explain to him what's going to happen October of 2028. Okay, a couple years down the road. Explain that, please.
It's basically like you are turning 65, but it's like you're starting Medicare for the very first time again when you do turn 65. We'll get you on Part B at that point in time, or possibly earlier, as Marvin was explaining. You get the pick of the litter when you turn 65.
Reset the clock.
Yes, sir.
Yeah, reset the clock. I mean, that you, even if you can't do your B now with the supplemental plan, you'll be able to do so come October of 2018, because it's just like you didn't even have Medicare before. You do, but they allow you this second opportunity because of the different rules that are out there that could prohibit you from getting a supplemental plan. Okay, and there'd be no underwriting. So just keep that in mind. So my suggestion, sir, is in an hour or so, a couple hours here sometime today, call and ask for Nick, and if you can't get right to him, he'll call you back for sure. And let's just see what would make sense for you in January. But right now, great plan, sir. Any other questions that you have for us today?
No, that's exactly what I was hoping. What I could do is just wait till January. So there's no penalty if I don't take it now?
Not at all, sir. Not at all. Because, frankly, Medicare's glad you don't take it because they're not liable for you. So they make it very easy. And the key is because you're covered by an employer-provided plan. If you weren't, we got a problem. But because you have that plan, 20 or more employees, you are good to go, sir. Okay?
All right. Perfect.
Yeah, all right. Well, sure. Good talking to you. We appreciate you calling in today.
Appreciate you, Robert.
Yes, sir. Thanks for your help.
Yes, sir.